Welcome back to Inside Chlorpromazine, where we explore the science, mechanisms, and surprising potential of this classic drug in the modern context of COVID-19 and long COVID. I'm your host, Sowmya, and you're listening to episode 7, Taming the Fire, Chlorpromazine's role in modulating the immune response. Today, we are diving into the fascinating immunological world, how our bodies react to viruses, what happens when that reaction goes too far, and how chlorpromazine might help in striking the right balance. To help us explore this topic, I am joined by a microbiology researcher who specializes in host immune interactions and drug repurposing. Welcome, Chaitanya.
Thank you, Soumya.
Let's start with the basics. Can you walk us through what the immune system does when a virus like SARS-CoV-2 enters the body?
Sure. When a virus infects the body, the immune system activates two major arms, the innate and adaptive responses. The innate immune system responds first. It's fast and non-specific. It triggers inflammation, releases molecules called cytokine, and tries to contain the infection. Then comes the adaptive immune system, which is more specific. It produces antibodies and T cells to eliminate the virus more effectively. In most cases, the combination leads to recovery. But with SARS-CoV-2, especially in severe cases, this immune responses can spiral out of control.
That's when the term cytokine storm comes in, right?
Exactly. A cytokine storm is when the immune system overreacts and releases excessive amounts of cytokine signaling proteins that promote inflammation. In COVID-19, this has been a key factor in severe disease progression. The lung, heart, and the other organs can become damaged not just by the virus but by the immune system's overwhelming response. This is where immune modulation becomes so important. We don't want to suppress the immune system completely, but we do want to regulate it.
So, where does chlorpromazine comes into this picture?
Chlorpromazine is traditionally known as an antipsychotic, but it also has immune modulatory properties. It's been shown to reduce the release of certain pro-inflammatory cytokines like IL-6 and TNF alpha, both of which are elevated in severe COVID-19 cases. It acts in part by affecting intracellular signaling pathways in immune cells, like monocytes and macrophages. By doing so, chlorpromazine may help dampen the excessive inflammatory response, which is particularly important in preventing organ damage and improving recovery.
That sounds promising. But immune suppression is tricky. Isn't there a risk of blunting the good immune response too?
Yes, and that's the critical point. The advantage of chlorpromazine is that it's not a broad immunosuppressant like corticosteroids. It doesn't shut down the entire immune system. Instead, it seeks to modulate or fine tune certain pathways while allowing the body to continue fighting the infection. That balance is what makes it an interesting candidate in severe and even prolonged post-viral syndrome like COVID-19.
Has this immune modulating property being studied in other conditions?
Yes, even before COVID-19, chlorpromazine was studied for its anti-inflammatory effects in conditions like sepsis, encephalitis, and autoimmune inflammation models. It's known to inhibit microglial activation in the brain, which means it may also protect against neuroinflammation, something that's been increasingly discussed in the context of long COVID. So, its impact isn't limited to respiratory inflammation. It could also affect systemic and neurological inflammation.
What's the current scientific consensus on the use of chlorpromazine?
Several laboratory and Clinical studies have observed that patients already on chlorpromazine, such as psychiatric inpatients, had milder inflammatory markers and sometimes better clinical outcomes during COVID-19. However, more robust clinical trials are still needed. We are in a phase where the mechanisms are fairly well understood and the safety profile is already established. The next step is refining how and in which patients chlorpromazine might be best be used.
You mentioned long COVID earlier. How might chlorpromazine's immune effects apply there?
Long COVID involves lingering inflammation, particularly in the brain, lungs, and gut. Some theories suggest it's caused by a persistent low level immune response, possibly due to residual viral proteins or immune system retraining gone wrong. Chlorpromazine's ability to suppress excessive cytokine signaling and neuroinflammation might help reduce these lingering symptoms. This includes fatigue, brain fog, and chronic pain, which are all linked to chronic immune activation.
This opens up a whole new perspective on chlorpromazine, not just as a psychiatric medication, but as a precision tool to help the immune system respond more effectively without causing harm.
Exactly. While it won't replace vaccines or antiviral drugs, chlorpromazine may help have a place as an adjunct therapy, especially in high-risk patients or those already experiencing immune dysregulation.
Thank you, Chaitanya, for breaking this down so clearly. We have covered a lot today, and it's fascinating to see how a well known drug can offer new hope in a global crisis.
Thank you for having me.
That wraps up today's episode of Inside Chlorpromazine. Join us next time as we explore chlorpromazine's impacts on the nervous system, including its potential role in protecting the brain from viral damage in long COVID. Until then, stay safe and stay informed.